is an AGD specialist from the Kuwaiti board of AGD, and we have Dr. Noura Papabai. She is, inshallah, going to continue her studies in oral surgery at UCL in UK. And Dr. Alia Nafisi, she is working with the Department of Dental Materials at Kuwait University. Unfortunately, Dr. Yusuf couldn't join us. Maybe he'll show up, I'm not sure, we'll see. A little bit about myself. My name is Fahd Al-Farah. I graduated from Virginia Commonwealth University back in 2020, in the middle of the pandemic, of course. And I actually did this lecture and lab within something called the ADIA Fellowship, where our school gives us the opportunity to teach our colleagues, our sophomore and junior colleagues, and maybe do a little bit of research. So this is my city where I studied, Richmond, which is the capital of Virginia. This is the James River. This is the hospital where the dental school is. I'm sure you guys already know that there are 3 types of wound healing: primary intention, secondary intention, tertiary intention, or delayed intention. So as you guys know, primary intention is when we approximate the edges of the wound or laceration. The wound or laceration has to be clean, out of infection or blood. Secondary intention is usually whenever the wound or infection or the laceration is huge or big, we cannot approximate the tissues. So we leave it to heal by scarring and fibrosis. Tertiary intention, it's also whenever the wound is big, we let the area heal a little bit, and then we try to approximate it whenever it's feasible. So why do we need to suture? There are a couple of reasons. First, we want to adapt or co-apt the margins and achieve hemostasis. Another reason, we want to decrease bacterial contamination to the wound, so when you place like physical barrier. Third reason, we want to stop the bleeding. So also when you create a physical barrier, you stop the bleeding. And whenever the bone is not closed by soft tissue, the bone becomes non-vital, or the healing becomes very slow, because the blood vessels carry within them the coagulation factors and all the necessary enzymes. Too tight of a suture will cause ischemia, and whenever the hemostasis is not achieved, when you close the incision or wound, you might have a hematoma, which is bleeding underneath the skin within the tissue. So where do we place sutures? Either intraorally or extraorally. In our case, within the dental specialty, when we speak about extraorally, we mean maybe around the lips or in the face or in the neck. Intraorally, of course, whenever we do an extraction or raise a flap or make an incision. Common situations where placing sutures is important intraorally. Whenever you're extracting multiple teeth and you've reflected the papilla between the teeth that being extracted, or even the adjacent teeth, if you place some kind of material inside, alva gel, Surgicel, gel foam, or any medicinal dressing, and if you place some bone or membrane inside the socket, so you want to secure that, keep it in place. Another example is if you reflect the gingiva and mucosa for barrier access for extracting third molars, especially impacted third molars, if you need to make a buccal trough and section the tooth. And another example, whenever you want to do alveoloplasties, exosses removal, or tori removal, you want to have a good access, so you're going to reflect everything, and then you have to put everything back and adapt it back like it used to be. Another thing that you might actually do in polyclinic, I encourage you to try it and do it, not to refer it, which is taking a biopsy. Of course, you could take an excisional biopsy or incisional biopsy. In case of mucocele or fibroma, maybe, you could do an excisional biopsy, and that's actually the definitive treatment. Okay, so for today, each one of you will have their own kit, and inside the kit there are the basic instruments you're going to need for the exercise and even for practical treatment. As you see, this is the needle holder, the first instrument, which is going to use in the beginning. The beaks are short and thick, as you could see, thicker than the hemostat, or as we call it, mosquito. You could see on the left side, the needle holder, the beaks are cross-hatched faces to ensure a positive grip on the needle, whereas the hemostat or mosquito, they have parallel grooves. Therefore, it's not going to form like a firm grip on the needle, so it shouldn't be really used because the needle might slide. Also, you could appreciate that the hemostat is a little bit thinner and longer. It might be curved sometimes. This is the correct way to hold your instrument, whether it's a needle holder, scissors, or hemostat. The ring finger and thumb should go into the rings. The middle finger should be next to the ring finger to help secure and support the lock on the needle holder. The index should be straight to help maneuver and direct the needle holder. This is tissue forceps, Addison tissue forceps. They could aid in moving the tissue and approximating the tissue. They could come with teeth or without teeth. Care must be taken whenever you use the ones with teeth because you might cause some trauma to the tissue. Don't grasp it too tightly. This is the scissors. Usually it's long and like thin. You want to cut the threads on top of the knot. The cutting edge are short, and the handles are long for better access. And the scissors are held in the same manner as the other instruments. So the suturing needle has different parts. The first part that's closer to the thread is called the swagged end. Then you have the body, then you have the point. The needle should be held 2/3 the way from the point, from the distance of the point. Needles are curved to ease the penetration and movement through the tissue by rotating the wrist. Also, suturing needles come in different ways, shapes, tapered or cutting needles. The tapered ones are usually used in the abdomen. They are round and smooth. They gradually taper towards the point. Shouldn't be used on tough tissue because they may cause trauma. They sometimes could be used on blood vessels, actually. Cutting needles, we have two different types, either conventional cutting edge or reverse cutting edge. They are triangular in shape. The apex form a cutting surface used for penetrating tough tissue like skin or mucosal tissue. All right, so let's talk about the most common techniques. Of course, you all know the simple routine interrupted. It's the most common one used. The advantages of using this one, if you have, let's say, a long laceration and then you place a couple of stitches, if one of them breaks or falls, then you have the rest holding the laceration. It's usually used whenever you have a displaced papilla or you elevate flaps. Usually it's 1 millimeter to 1.5 millimeter distance from the wound. It is preferred to enter from the buccal towards the palatal or lingual to place the knot on the buccal side. The second one, it's figure of 8, as you might of course know. It's a useful technique to stabilize extraction sockets, and whenever you place any kind of material inside, whether it's bone or membrane or alveoli, Sergicel as well. Continuous, non-interlocking. It's used mostly whenever you have a long or large laceration or wound, and procedures like alveoloplasties or torrey removal. Easier application and faster than interlocking, because whenever you do interlocking, you have to lock it every time you enter the wound. Disadvantages, it cannot be adjusted after it's placed, and whenever the knot breaks, the whole thing is gonna fall. Continuous interlocking, locking the suture, as we will show in the practice, will help keep the points before the lock secured along the length, and thus locking helps keeping the earlier placed points tight, additional to when the suture is complete. We have horizontal mattress and vertical mattress. The horizontal mattress is used to reduce the number of knots, sutures. So you're gonna have the first knot and then the second knot. It could compress the wound tightly and avert the edges. The vertical mattress could be used to approximate and close the reflected papillas. If, let's say, you cannot place or throw a simple interrupted. So this is the way you could, let's say, take a biopsy. You could make an oval shaped or incision. You want to assess how deep you want to go, and of course pay attention to the anatomy around it, whether it's vessels, nerves. You want to go as deep as you need and make it symmetrical. A good thing, if you have an assistant to hold the tissue for you, stretch it, and when you make your cut, then you want to dissect with a blunt instrument around it, so you could readapt the tissue back. As you see, they placed some interrupted sutures. Important principles while suturing: you have to assess how deep you want to go, so try to make it symmetrical on both edges so you don't have an overlap of the tissue. When you want to enter the tissue, try to go 60 to 90 degrees to the wound to avoid tearing and injury of the tissue. There are different types of knots. Mostly use a surgical knot where you do positive tie and then negative tie and then positive tie. We're going to show you that in our video and in the practice. So to summarize today's lecture, we talked about different types of healing. Then we talked why do we need to suture, where do we place sutures, classifications of sutures, whether they are absorbable, non-absorbable, synthetic, or naturally occurring, the sizes of needles, common situations where sutures are needed intraorally, what's inside the suturing kit, of course, and different suturing techniques, and the important principles. Yeah. So that's basically it. I hope it was informative and short lecture. This is actually one of my favorite quotes, and I hope it resonates with you guys. These are the references. They are actually really good references. I'm gonna share the lecture with you guys if you need it. Let's try. So we're gonna play a short video. I hope it's... I'm sorry about the voice if you cannot hear it. We will actually go through everything with you guys one-on-one.
Hello everyone, this is Fahad Al-Khouray. I'm a senior dental student at VCU School of Dentistry. This video is an educational video made for the ADIA Fellowship with the Department of Oral and Maxillofacial Surgery. Okay guys, so we've got our oral cavity model here. It has some sockets, extraction sockets, big flaps here, and we have our kit over here with all the instruments you need. So we have the Addison's tissue forceps with the teeth. We have our hemostat. We have our blade holder. We have our scissors, and we have our needle holder. Okay. Also, we have in the kit these suturing material, and we have some blades if you wanted to make your own cuts. And this is a nice little kit. You could practice on your own at home. I used to practice a lot in my sophomore year, especially when I was transitioning to clinic. That was very helpful. So I highly recommend that. So the best way to hold the needle is 2/3 the way from the tip. So not at the end and not at the tip. Okay, so 2/3 the way from the tip. The correct way to hold the needle holder is your thumb in one ring and your ring finger in the other ring, not your index and not your middle finger. Your index should go straight to help maneuver and direct your needle. The middle finger should help secure the grasp. Okay? Also, another technique you could do is by palming the needle holder like that. It gives you more freedom of rotation and movement. So today we're going to start with the most basic suturing technique, which is the routine simple interrupted suturing. Usually you want to start from the buccal and go towards the palatal or lingual. So the knot ends up in the buccal, and that's very useful to avoid the displacement of the knot by the tongue. Okay, so I'm gonna use my tissue holder to hold the tissue, and then you would want to enter at 90 degrees through the tissue, and then you want to assess how deep you want to go, and then you would rotate like that. You could either do one bite or you could do 2 bites at a time. I just did 1 bite right now. And then you'd want to pull all the way and have a short end, about an inch maybe. Okay, and then again you would want to hold it the same way. Okay, so you'd want to go again at almost 90 degrees to the incision or flap. I would hold the soft tissue with the tissue forceps to hold it still, and ideally you'd want to make it symmetrical to the other side. So if you enter 1.5 to 2 from the incision, you would want to mimic that on the other side. So I would hold this to not lose it, and have it about an inch. And then I would try to keep the needle in my hand so I don't lose it and it doesn't hurt anyone. Okay, so I'm gonna give you an easy tip. Always do your loops toward the short end, and then tighten the knot on the other side, to the opposite side. Okay, so we're gonna start with a 2 loop. You need to have enough distance, so about 2 palms. Okay, and then you do your first loop, second loop, then open, and you want to grasp the tip of the short tail. Okay, and then as I said, you would tighten it in the opposite direction, and then you do 1 loop toward the short tail, grasp the tip of the tail, and then you're gonna tighten it in the opposite direction, and then another loop, last loop, and there you go. We'll use our scissors, and remember, you don't want to position it more towards the buckle, and cut it 2 to 3 millimeters. That's it. There you have it.
Sorry. So this is important. I just wanted to say that this is important, that the first knot, you have to pull it across to make it flat. If you don't, it's gonna get tangled. Okay? So let's continue.
Alright, so our second technique for today, we are going to do the figure of 8. This technique is very useful in case of gel foam and socket preservation, and if you have some medicinal material you want to keep for a dry socket. So as we discussed earlier, guys, you'd always want to go around 90 degrees to the incision and 1.5 to 2 millimeters away, and always assess how deep you want to go. So I'm going to grab my tissue like that, and then I want to rotate like my arm like this. Do not push it, just rotate it. It's going to do its job. Then I'm gonna take it all the way. So, and I have a tip for you, a trick. Instead of pulling all the way like this, you may hit someone. You could just place an instrument like that and then just pull it like that. Okay, but be careful, don't lose your short tail, and we'll always leave it at about an inch. We're gonna go and do the same thing. Do another bite through the palatal. Always go around 90 degrees and 1.5 to 2 millimeters from the incision. And I'm gonna do this trick again. Alright, don't lose your short tail, and always remember, guys, you want to start on the buckle whenever you can, so the knot ends up in the buckle and don't get displaced by the tongue. Okay, alright, so we started on the buckle, did the palatal. We are going to go again on the buckle from the place we started. You go bite again through the same place you started, and then I'm gonna do the rotation movement. Don't push it, it's gonna do its job. Alright, you don't want to grasp the needle with the tissue forceps because it's not designed for that. Okay, have enough room. Okay, and this is called figure of 8 because, as you will see, you'll have a kind of figure 8 shape. Do the same principles. Hold the tissue like that. Okay, and now just like what we did for the simple interrupted, we're gonna do 2 loops toward the short end, and then go and grab it, and then pull across, just like that. And then you go do a single loop toward the short end, pull across. Okay, and then you do 1 last loop toward the short end, and then you're gonna pull across. And then there you have it. Just you'll cut it. And there you have it. That's why it's called figure 8, because it kind of looks like an 8. Guys, so lastly we're gonna do continuous non-interlocking suture. This suture is very useful for if you have large flaps, and it's very quick and easy. In future videos I may do continuous interlocking and horizontal mattress and vertical mattress. Alright, so you want to start with your simple interrupted suture. Very easy, we've done it before, right? And then you'll hold it like that, do this trick, get it all the way. You have your short tail, don't lose it. Alright, you want to go to the lingual palatal, just like what we did. Just do your simple interrupted. Okay, 2 loops toward the short tail, pull across, 1 loop toward the short tail, pull across, and then 1 loop toward the short tail, and pull across. Alright, perfect. So now, instead of cutting both ends, you'd want to cut only the short end, okay? Just the short end, cut it, perfect, you're good. Alright. Next, you'd want to kind of run the suture through the flap, okay? You're gonna decide what I mean. So, you want to start on the buckle. I like to go on an angle, I think it looks nicer. Get your bite. Okay, there you go. Perfect. And then the equal distance, you want to go on the lingual or palatal. Equal distance, make it symmetrical. The same thing. So if you entered here, you want to go here, exactly the same on the lingual or palatal. Perfect. Okay, so now also you want to go equal distance on the buckle, so from here to here. Okay, so I did not go very far, so I'm not going to go very far on the next one, just to keep it nice and symmetrical, okay? There you go. And now we go on the lingual, the same side. Perfect. And next you go through the buckle. I'm not gonna do the entire thing, I'm just gonna do a couple more just to show you equal distances, so I did not go very far. I'm not gonna go too far. Go like that. Perfect. Now towards the lingual. Good. Okay, one more towards the buckle. Take my tissue forceps and go like that. Awesome. All right. Go through the lingual one more time. So now if I want to close it, okay, I would go through the buckle one more last time, okay? Exactly the same way you did on the other ones, equal distances. Go like that. Pull. And now, instead of pulling through all the way, I would leave this loop and I would use it as a short tail, okay? Just like your short tail. You do 2 loops toward the short tail. So this is my short tail. Take it and pull it all the way. Awesome. And then you do 1. And then you do 1 the other side. Sorry, it's gonna get stuck. Awesome. Yep, that's it. Just cut it. Okay. All right, so let's turn on the lights, please. Okay, so let's start the practical part. I hope you enjoy the lecture. Please, after you finish, just scan the QR code and then there is an evaluation. Please fill it. And if you didn't give my sister your civil ID number for the CME points and the certificate after you finish, do it, please. Okay. Mine.